Health systems across Africa face common challenges: limited access to health facilities, a shortage of medical professionals, and an infrastructure that can barely keep up with the needs of the population. But in these challenges lie opportunities for transformative change. Let's take a closer look at Gambia, a country that is ready for positive change. In Gambia, the healthcare system is a mix of modern practices and traditional medicine. The existing medical practices and hospitals urgently need investment in modern medical equipment for diagnostics and treatment. Modernization of the buildings, including treatment rooms, operating rooms, and corresponding hygiene measures, including the provision of sufficient materials for emergency and wound care. The sufficient supply of local pharmacies disguises the actual emergency and basic health care. There is a growing demand for innovation from patients and an urgent request from the protagonists of the Gambian health system for investment to improve overall care.
Everybody see this is the emergency room of the Fatoto Hospital. Look at the hospital of the Hatoto. It's still same standard. Why? Since 1920. Since 1920, there's a lot of patients here, sick patients, but they don't have nothing.
The commitment of health professionals, coupled with a deep cultural heritage, forms the foundation on which we can build. Meet Dr. Lamin Sora, also known as Dr. Hope. With passion and commitment, he works tirelessly to provide his community with the medical care it needs. Dr. Sora highlights areas where change is most urgently needed.
We are at Jamweli village where the women, we try to ask them some of the problems that they are facing in terms of healthcare services. We came to realize that they don't have even a health center here or a hospital. They don't even have, you have pharmacies, but they are far away. So sometimes they have a lot of problems in terms of labor cases. So when the women are at labor, they have to move them from here down to Sukuta. Sukuta is very far, so sometimes they cannot afford it. The community, we are appealing to the government and every investor or anybody outside there to help these people, because they also have families. They have families here. They build everything here, so sometimes they have that problems with healthcare services. So in this country, it will be very important if they have a health center here and a diagnostic center whereby you can check some of the communicable diseases and non-communicable diseases to know their problem and see how we can tackle this problem. So together we can do it. If we have anybody who can come up to their doors and help them, we don't have a clinic here, we don't have a hospital here, we don't have a diagnostic center. So we are appealing to everybody listening, especially the investors, to come out there and help our people. Together we can do it, and together we can save lives. Thank you.
Introducing Med Solutions, a groundbreaking initiative to transform healthcare in the Gambia. With innovative, practical solutions, Med Solutions addresses the very problems described by Dr. Sora. This is just the beginning of what can be achieved through strategic investment and collaboration.
Dear investors, dear members of the Solutions for Health family, you watch this video and you see the real situation of the African, especially the Gambian health system, and the people really in a big need, because we have not the right treatment, we have not medical equipment, we have so many things they felt it's unbelievable for us in Europe. The people must drive really long time, hours and hours, especially most of them to Senegal, yeah. And when you are really sick and you have a big problem, yeah, you can die. It's very dangerous. And also the normal things we have in Europe for us, it's daily work and so on. Here it felt, and really with these little steps we can save lives. Yeah, this is so important that we now start, yeah, to help these people, and also this is a good invest Your money is safe, you have a benefit, a good benefit, and also the best is that the most beautiful benefit is we can save lives together.
Listen to the stories. Feel the heartbeat of a nation ready to move forward. These personal experiences remind us of the importance of accessible, quality healthcare for every Gambian.
Hi, my name is Lami. I'm a 38-year-old man. I am a visually impaired. Also, I'm a music teacher and djembe player. I teach persons with disability, drummings, and blind people and the deaf people. I feel normal like any other person. I only don't like this stigma because that to take it off in the Gambian society is very difficult. I face it every day-to-day life, but it didn't stop me. It makes me want to do more.
What would you like for the other experts outside the world in Europe and other countries to do for you as eye experts?
What I would like them to help me to see. That will be very important for me if I could see, if I could get a chance to see. And the only way forward to have a chance to see is to ask for help from other people. And thanks that I come across solutions for health. Also, I think I have a chance.
But the Gambia is more than its challenges. Known as the Smiling Coast, it is a country rich in culture, natural beauty, and the warmth of its people. This is the vibrant community where your support can make a huge difference. Now they invite you to be part of this journey. Invest in innovation and change. Invest in health. Invest in the Gambia.